I'm just going to go over a brief update on where we are in the department and the growth over the last few years. The big news is that Callahan Eye Hospital has undergone a significant expansion in its OR capacity. The 7 new ORs were opened in April of 2017, which brings us to 16 dedicated eye operating rooms, making it one of the largest dedicated eye facilities in the country. This is designed to meet the growing need of Alabamians for eye care in the region, which has expanded greatly and is going to continue to expand. This will open up block time for our existing surgeons on the medical staff, and also open up opportunities for those of you in the community as well to operate at the eye hospital if you've been having trouble getting block time as well. The door is open. We really want to get this going. The turnover is atypical for an academic institution. We're able to turn over ORs fast with a very efficient pre-op and post-op areas. In terms of education, we have several new people joining us starting in July of this year. We've matched our 5 residents. I had 450 applicants in the match this last year. 1 from UAB, 2 from MUSC, LSU Tiger, and a gentleman from Nevada as well. We've matched our 5 fellows and have expanded our fellowship in 2 ways. One, we've expanded to 2 glaucoma fellows, given the expansion in our glaucoma faculty, and we've added a low vision optometry resident for the 2nd year running, Elizabeth Cameron, all of which will be joining us in July, and this coming July. In progress for this year, we're going to be integrating the Lions Clinic to the clinical faculty clinic, full-time clinical faculty clinic, merging EMRs and creating more integration there. We've created an education block around grand rounds and faculty meetings every month where we block our surgery and clinical time so we can focus on the educational mission, and change compensation models within the department to further incentivize academic education over just straight clinical practice. We're also going to be rotating in the next year faculty through the resident clinics and broadening the surgical experience with faculty. Dr. Lawley and Dr. Reed are focusing on developing a more in-depth refractive cataract experience, looking at the femtosecond laser and the aura and astigmatic lenses. The residents this past year in 2016 gave care to over 8,500, close to 9,000 patients in the Lions, VA, and Cooper Green clinics. The case volume remains high with over 700 surgical procedures per resident, and in the 2016 year that was complete had about 195 phaco emulsifications, and that's been pretty stable over the last several years. We've started looking at vitreous loss rate. I'm happy to brag on the exiting 3rd years. The vitreous loss rate last year was 2.1%, and the 3rd years that are going to be graduating soon, we don't have the complete data on, but are going to be running at about the same level of vitreous loss rate. And that compares in the literature to a vitreous loss rate of about 3 to 10%, with most programs running at about 8 or 9% vitreous loss rate. So we can applaud our residents today. They're doing a really, really good job in terms of efficiently learning surgery. We haven't plotted that over time, which is the next step. I think that'll be interesting to see. All right, so the clinics have continued to grow. We integrated with the hospital last year and converted to EMR, which many of you have experienced as well in private practice. It's not any more fun in a large group in an academic center. We didn't lose any volume through that year and saw almost 80,000 patients through 2016. The emergency room visits have continued to steadily grow and are higher in the 2017 year than they've ever been. In terms of clinical growth as well, we've built out the 2nd floor clinic of the Callahan Eye Hospital that's contiguous on the same floor as the original ORs, and that is an anterior segment clinic that does advanced cornea disease, dry eye, and anterior segment. Their advanced services, cross-linking, dry eye, the LipiFlow, all in one location to serve those patients better. We've also opened a Cahaba River clinic. We have a lot of patients in that area that need general concerns, and we're The whole goal is to try to offload those general patients into the community so we can take care of them in the community and then keep the more tertiary complex cases seen in the clinics at the eye hospital. Over the next year, in the next few months, we should finish the renovations of the 4th floor clinic, which will be plastics, general and glaucoma, and also pediatric ophthalmology, and that'll decompress the 6th floor and give us a little more breathing room. We're opening up 2 satellite clinics in Gardendale and Pell City, and we'll be integrating both the Lions Clinic, as I mentioned, and the low vision service into a single EMR to better integrate those services with the rest of the faculty practice. The ultimate goal, once this is all done, is to, once we've decompressed the 6th floor of the eye hospital, is to turn this into a translational research clinic where we'll have posterior segment doctors, glaucoma, neuro, and imaging in that posterior segment imaging on that floor with the clinical researchers. So the clinician scientists are focused on those diseases with the scientists and all the shared equipment working together to give us a footprint in which we can continue to develop clinical trials and clinical innovations. Over the last year, starting in July, Marissa Losi, an optometrist who's completed a low vision fellowship with us, will be joining us to help with the low vision service and also clinically work with Priscilla Fowler and the other people on the 2nd floor to deliver dry eye care. And Sarah Jacobs will be joining us from her fellowship in Seattle, who's an oculoplastician, and will be starting in early August. So the faculty have steadily grown over the last several years. In 2017, we should reach 50 faculty, 15 residents, and 6 fellows. In 2016, we had 18 research faculty, up from 10 in the last few years, and that will go to 2021 with the addition of 3 research scientists that will be joining us in July. Bringing us on to the last bit, the research mission. We've had a record year for publications across a broad area. Our focus areas really are macular degeneration, glaucoma, visual performance, visual neuroscience, retinal disease, and ocular biomechanics. We've had a pretty explosive growth in our research portfolio. If we look at where we were several years ago, we were a little under $2 million a year in federal funding in research from the National Institutes of Health. And as of 2016, that went up to almost $5 million, and we've had a significant number of grants come in, along with the recruitment of several faculty that will be joining us in July to increase that grant portfolio and push the research mission forward. So we've had 6 new federal grants hit since January of this year, and we're also recruiting Dr. Michael Bolton, who will hold the Research to Prevent Blindness Dowd Ritter Endowed Chair, and his spouse, Maria Grant, who will hold the Austin and Ivor Callahan Chair, sponsored by the International Retinal Research Foundation. In addition, Lynn Rossett, who's a glaucoma clinician scientist, and they'll bring several large studies to UAB and to Birmingham. They're all from Indiana University. Then they will all start July 1. When we look at our academic rank in the last several years, we've made some gains. We were running around 38 in 2012, 2013, and we hovered in the upper 30s. Our goal with my recruitment and our chair package was to get in the top 20, and we made that goal in 2016. We're 17th in the country in terms of NIH federal support for research. With the additional 6 federal grants and the three new grants coming in with the new researchers, we should be somewhere between 5 and 10 in terms of NIH rank. And if we achieve that by October, which is when the fiscal year closes, we will be the fastest growing ophthalmology department in the country over a 5-year span. That's changed the landscape. It's put us on the map for nationally, I hope, and it will help us further in recruitment. It's also changed the landscape at UAB. Previously, the vision research community was really split between the School of Optometry and the Department of Ophthalmology, with about 50% of the grants held by each party. The School of Optometry was running about $2 million a year, and as were we. That's really shifted, where our grant portfolio significantly increased in terms of federal grants this past year, moving in ahead in this current year, 2017, it'll be about 18 federal grants in optometry, in ophthalmology and School of Medicine, and four in optometry. So a significant shift. I'd like to applaud our researchers because this is really a tremendous achievement. Gaining these grants are harder and harder. The funding line for the National Institutes of Health is decreased, and the amount of these grants continues to decline and decline. So keeping that research engine funding takes a tremendous effort on the part of the researchers and as a challenge going forward. But they've really done a great job. So just moving forward, we face a lot of challenges as a department. We face a lot of challenges in private practice with the changing clinical practice environment that's more and more volatile. The decline in federal research funding that has happened and is going to continue to happen presents a challenge and a financial burden on departments to keep that funding, to keep that research mission alive. Educational needs, certainly state support has continued to decline as well. So we need to keep all three aspects of the academic stool supported and moving things forward. I think we all appreciate the increasing regulatory burden that we all face across all these missions: education, research, and clinical care.